faith has made you whole.
Faith has made you whole. Now we need a Testament scholar for the Greek here, of course. What does that mean? And I think we're back to this whole problem of cure versus acceptance or an equilibrium. I mean, if you know the works of Hans Georg Gadamer, the philosopher, he talks about return to an equilibrium of health. If you've been in a disequilibrium, so is it about return to an equilibrium? Or is it actually you were saved? Actually, the key thing is you found faith in Jesus Christ. Secondarily, you've actually got a better leg. You know, that's the sort of tensions I think on that, and I need to look at the text. But I'm going to talk a little about consent in Jesus' ministry. Another one, sorry, coming up.
Just on that, I'm more on the Old Testament side than the New Testament. So and so is translated both as saved and as healed, isn't it? It's in the New Testament.
Yeah.
So, I was curious as to, did you deliberately not tell us the background, the denomination of the quotes? Was that deliberate?
It was not deliberate in the sense of I need to keep this secret. I suspect it was there wasn't enough space on the slide. An extra effort to do it. So I didn't do it, but it wasn't deliberate in the sense of keeping things secret. So if you want to throw a quote at me, I can try.
I mean, I think what was interesting was we had, I suppose, a couple of charismatic evangelical Anglicans. We had a little Catholic who was a chaplain. We had someone more in the mainstream, very influenced by Jonathan Edwards as a Puritan thinker. We had a Roman Catholic priest, a male, obviously. One of those was a woman within the Anglicans, and we had a woman Methodist minister. We had a black Pentecostal who was the one particularly who was keen, as we noted, to go to the doctor. Because actually, if you ask who are the most sensible people who know most about this, it's the Pentecostals, because they've been doing it longest. They've been dating 906 or 980, or it was. In other words, they've got a century of solving all this nonsense. They cut through the tape and they understand it. We're just faffing around. Especially we're 1970s charismatics. We're young in the faith on this one.
If I can just challenge that.
Come on.
The Catholics for centuries have been keeping an archive at Vatican of healing miracles, so actually they do have the historical claim to be doing it for the longest.
They're only charismatic. Yeah. So yes, but I think it was interesting that we saw that within that particular tradition, and that typical of Pentecostalism, I think, in the sensible level of Pentecostalism, if you like. And I think there was one other person who was free church evangelical, but again within a clearly reformed but sensible reformed tradition. So in a way, those are my pejorative comments, whether they're sensible or not. They're sensible in my way. But in a way, I think what we tried to get was a spectrum of people who both, there was no point in Rich going to spend an hour with someone who said, oh, I don't do healing. That would have been pointless. Equally, we said it wasn't representative of anybody other than these 8 people. They were offering us snapshots, which we thought had validity, in that they were doing it, they were practitioners, they were effectively ordained, even if their church didn't actually do ordination. They were sorry, was it a question you were going to give us beyond that? No, that was where you were.
It was,
yeah. So that was, I think it was partly deliberate and partly just space, but I think we wanted not to, because I think the difficulty with that is you do rather stereotype. And if you'd said to me a few years ago, before I met some people who were involved in Pentecostalism, I might have said that they didn't think seriously about it, because they do. And I think that's where coming at it from that stereotypical point of view.
That's my background. And I think probably we've learned from our mistakes.
Of course, exactly. You've had to deal with all the fallout. The Pentecostals have had to deal with the problems over a century of where it's gone wrong, as we had in the health service, and trying to manage the failures and the misunderstandings that we've allowed to happen without structures and methodologies and case histories, which of course is your point about the Catholic Church and the Orthodox. We didn't actually find it on from the Orthodox Church. We might have done that. Any other?
Yes, this chap.
Yeah.
I just want a simple definition of what you mean by healing or recovery.
What I mean?
Well, can we say that there are various medical professions here? Can you talk in your training councils as healing or recovery or whatever word you use? I use recovery because there's now a word going around recovery colleges in London. That's quite interesting in some respects.
Yeah, okay. Obviously that's a question I asked my sort of expert panel what they thought healing was. And of course you get as many answers as we have in this room or more. I think if I just go back to Gadamer's idea of an equilibrium or return to a state of equilibrium, I think the difficulty of that is, what if you were never in a state of equilibrium? In other words, if you were born or you had an early experience actually before you were fully formed, which wasn't very good, for whatever reason, then in a sense to return to that may not be where you want to go to, or something's happened. So actually, I would want to take that on further. The World Health Organization will tell you about this perfect state, complete physical, mental and social well-being, not merely the absence of disease or infirmity. That's health, of course. I'm giving you definitions of health, of course, not of healing. So I suppose if you're talking about a return to health or a full experience of what it means to be healthy, you've got the same problem. How you define health, how you define healing, and is it a return to that? I think Karl Barth would talk about health as the strength to be as man, he would put it, of course, or woman. So there's this sense of the strength to live a human life, which of course the famous Moltmann quote, which I think is probably the one that we would talk about health in certain Reformed contemporary church traditions, where health is, as he says, is a strength to be human, the strength to be human, displayed in the person's capacity for happiness and suffering, in the acceptance of life's joys and the grief of death. So health is the strength to be human, if you like, humanity lived out in its fullest sense, but conscious of both the joys of life but also of suffering and death. In other words, I think someone today was talking about some of the difficulties that why faith seems to be helpful is that it does address the issue of death. Much of society is not able to handle a narrative about death, so actually what the Christian tradition and other faith traditions allow is to put death on the table to discuss. And I would also argue, if you look at the lament psalms, particularly something like Psalm 88, which you think, life is terrible, it normally ends, but God is wonderful, life is terrible, life is terrible, life is terrible, you turn over to the next psalm. There's no hope in it. And in a way, I think if you go back to people like Brueggemann and others, and John Bell would use this in his teaching on lament, traditions of lament, it allows a conversation. I'm not asking you a question, by the way, but into that. So I think for me, healing, in most people's understanding, if I say to someone, my patient or to anyone else, come to a healing service, I think the assumption is I'm going to go with my wart and it's going to have gone when I go home because it's been cured, it's been removed. Now, that's a very narrow definition, I think, of what healing is, but it's a very valid one in terms of what people hear it means. And that's one of the things we'll come on to in a minute, I think, about the nature of my 5 letter C's, of which one key one is consent. What are people consenting to if they come forward into a healing context? What do they understand? How have they been informed? Because obviously in my medical world, what people are consenting to is very important. They know what it is they're coming to. So I would want to say healing is something around this entry into this state that Moltmann talks about, the strength to be human, to live a fully human life, but also in the context that it's also lived in the face of death. So I mean, that would be where I want to bring a lot of richness into the healing, not just my wart's gone or whatever, you've got a lot of money or something. Any comments on that? Yes, Leo, do you want to come in? Yeah.
Well,
Leo.
You have to help me out a bit because I'm not entirely comfortable with some of this research. I don't know why. Not that I don't respect it. I mean, perhaps it's the only way one can research it. There may be no other way of doing it. I mean, there are some methods of healing which I didn't, maybe they are being used, but I didn't see any reference to it.
Right.
For example, I mean, it's just a personal view. It's a friend of mine, he was actually Professor of New Testament in Birmingham. He said that Jesus out-listened other people. That's why he healed them. And I find it's always this question of, oh yes, it's almost as if Jesus did a kind of zap job on people. I don't think that's true, I'm sorry. I don't think it's magic. I think it's something quite different. I think it was the way he related to them. And I think the profounder the listening is, I think most people find listening quite difficult. And I don't mean that disrespectfully. It is a special art, if you like. And I think it's a part of the healing factor. But I didn't feel, when I was listening to these examples, that they were people who were listening. I may be quite wrong.
I think it's a very fair point, and I suspect that the listening thread didn't rise through
No.
what I was saying. It was there, though, and there were one or two. I think the Methodist person that I spoke to particularly would have resonated with what you're saying in relation to listening, and indeed linked that to acts of service and kindness. And for that person, that was the major, one of the major threads of her healing practice. I suspect the people that I was talking to were, maybe the sample was skewed a little towards folk who provided healing events in which they preached and people were brought forward and things happened, so it's very proactive healing activity in that sense. And
Can I
maybe
just
that
ask a question there?
dominated.
One of the things that interests me, I mean, there's no evidence as far as we know in the New Testament of Jesus having healing services. And you see my point? And maybe these are not occasions that can perhaps support this kind of work. I don't know. As a matter of fact, I had to declare to you, I do belong to, linked up with the local group in Durham, in Riverside.
Oh, good.
Yeah. So
I mean,
I'm not opposed to it. Don't misunderstand me. But I feel slightly uncomfortable even with some things we do.
I think, if we go back to our 3 V's, variety was massive. There were people who go out on the streets, put up a stand in the main square of Newcastle or Durham, and say, come and be healed by Jesus. Healing on the streets. There'd be people like knights going on to the sort of night economy, going out and offering people support, water, shoes, but also we'll pray with you. Others in the home, others in a nursing home, others in hospital as official chaplains, and if you like, part of a clearer remit. Others in church services, others just in communion services, or come to the rail as part of, I think it's, I'm with you, Theo, on this one, but there's huge variety. What we want to do, this is very much a scoping exercise. We're not claiming that it's representative, but it is, if you like, an overview. And we also, depending on what they told us, and if listening wasn't a big issue for them, we missed the people for whom it was. Do you want to come in quickly?
If I can just quickly, I agree with what you're saying. I agree with your point. I'm thinking about the research and what I found and how I've tried to present it to you. I think there was a great variety of practice out there, and I've been quite careful. I hope that's come across. I've been quite careful, actually, not to judge it myself and say this was said to me, but I think it's nonsense. So I haven't said that. I do think, though, it is my reflection that within that variety there is tension. And beyond that, I actually think there's confusion as well. I think some of the things that people were saying, some of the things that they were saying, just didn't stack up. Inside their own arguments, they didn't stack up. But I wasn't there to challenge them on those points, and I haven't presented them to you in that challenging way. And I'll offer one example, and it picks up on the listening theme, which I'm glad you've raised, because it will prompt me to emphasise it more later if we do this again. And that is empathy. There was a person who taught healing practice to others, and he was quite adamant that he told people not to get involved with empathy, not to empathise with the people who were to be healed. And I just felt that doesn't stack up. It doesn't stack up with listening, it doesn't stack up with acts of service and kindness, it doesn't stack up with all sorts of things.
There is a theme also, I'll come back to another comment, between what you might call healing as transaction and healing as transformation. I'll just leave that in the room. But if you thought it was just transactional, I give you a pill, you get better, or I take your wart off with a curette, versus through this process you and I will grow together and develop and we will feel in a better place, i.e., and that idea could be transactional, couldn't it? Don't get involved, just do it, and move on. Another question in the comment. Anyone else want to? Yes, yes. She's had a go.
No.
Dove, do you have a question?
Yes, we'll do you then.
Okay.
Yeah.
I'm interested to know whether this healing minister working along with the medical system or working against.
Right.
Because medical system mainly is the transaction.
Yeah, increasingly so.
Yeah. And also especially about mental health.
Yeah.
It's depend more about the medication.
Yeah.
So if people come to those healing ministers, so how they work along with the system, because they don't want to feel they use religion to interfere with medicine. But we know, for example, in psychiatry hospital units, the social worker, they work along with psychiatrists as a team. The social worker has great power because they have more time to intercourse with the patient. So they will give psychiatrists a good suggestion about maybe you should reduce medication or maybe you should change medication, because they do more record and do more observation. But how about as a healing ministers, if you know your parish, like your members, you know them on a daily basis, they often come to you for healing, because this is not just one time or 2 times like they need prayer. But maybe your observation is more true than social worker. But how are those healing ministers, they interact with the...
Okay, I think there are two questions in a sense. One is what about what you might call the formal relationships? Are there relationships worked through between the health service in its broadest sense and the church? And again, I'm not sure we really explored that because it didn't come out. We asked, Rich asked fairly open questions and got back whatever came back. If it came back, it was significant because they brought it up. We didn't then ask a series of fixed questions beforehand to say, what would you do with the doctor? I think the other question is really about, which I think does come out, the idea of making a cup of tea, baking a cake, being a community, being a place where people can feel valued and supported as a means of helping the healing or the support of those people. I don't think you got much out of the health service, did you, in terms of...
No.
We didn't really get much back on that. They weren't saying we were linking with a local doctor or... I don't know, Chris, you've got any comments on that?
So what's your view?
Well, my view would be, I work in Belmont on the edge of Durham. I used to write with the local vicar books on ethics and medicine. And I would work with the clergy if that was a good thing to do. And many of the parishioners knew we were a practice where they were Christian doctors, as the doctor were identified with the church. So in a way, although we were very careful, I hope, cautious about the barrier, or not the barriers, the boundary between ourselves as NHS doctors employed by the taxpayer and ourselves as church people who were Christians. So I think there was an important attempt to maintain that barrier, which might come on to in a minute about what I call confidentiality and consent, which does overlap with some of this. My view is we'd like to explore this more, we'd like to understand more what the feelings on both sides of that dialogue are between those for whom they are official ministers of the church and those who are official ministers of the state health service. I think the difficulty though is, I think as Rich did point out, people's presuppositions coming into the healing ministry, which we were trying to explore, if they believed very much that it was a transaction of the zap, quite opposite to Theo's point, I've got this gift from God, I'm going to lay hands on you, you're going to fall over, your leg's going to lengthen. That ain't going to help, and with no empathy, that will not help your sense of careful listening and engaging and supporting and feeding back. And sometimes we would get people saying, we think so-and-so isn't very well today and maybe you could come and help, or perhaps a referral to the nurse would be helpful, the psychiatric, the community psychiatric nurse, or the psychiatrist, or the team, or the crisis team. So I think unfortunately, recent publicity has put doctors in a more difficult position in the UK because of a case within the last year of a doctor in a so-called Christian GP NHS practice praying with a patient and a significant complaint being brought in, ending up in the General Medical Council, who are the regulators of doctors in the UK, and the person being reprimanded, the doctor, for misplaced intervention in prayer or conversation. I think it was a mistake on the doctor's part how they responded. I don't know whether it was a mistake what they did, but as always, the follow-up was the problem. So I think yes, we need to work on it, and I think there is a place for good working together. But I think it's much, you'll know much more about this in terms of a hospital, setting where things are the boundaries are much clearer, I think, and the responsibilities are much clearer.
And I mean, I wouldn't challenge a psychiatrist over their medication that they prescribe.
No, exactly.
I would hope I'm being seen as part of the team. I had a psychiatrist just the other day who said, I think this gentleman should come and talk to you.
Yeah.
I think you will be able to help him.
And that certainly is the experience of many chaplains and others who use the chaplaincy service. And I was in the prison as a prison doctor for 20 years at Franklin Prison. Again, how we use I still work as a GP, but how we use the chaplains at the high secure prison to enable people to find ways of coping with being in prison, a form of healing and wholeness, which was essential to their survival and flourishing, and maybe being transformed. Rather than a sort of simple transaction, here's an injection, here's a pill, or here's a methodology which will just try and calm you down, rather than trying to move you into a better place. Anything else just at that point? Because I've just come on to confidentiality and consent. If anyone else got any comments? I mean, what struck me in the variability, I think the virtue one is difficult. I mean, what we were trying to make a judgment of, whether we thought this was instrumental. People wanted people to become church members, so they offered healing, they got healed, and they became church members and paid their subs, We didn't really sense that, although there was a subtext of actually true healing is to find Jesus, so actually that would. But actually the primary reason I think we thought was virtuous. People did want to do it because they felt called to this ministry. And why would they do it at 3 in the morning on a wet, dark street in Newcastle or Durham? Or why would they be called out as a chaplain, at 3 in the morning to the baby who's dying? Or would they, and so on. So I think there was a sense of heal on the streets, same again. I think there was a sense in which people genuinely did seem to want to do good. And maybe a secondary gain was they might get congregations, and also many of these were in the congregation anyway. But I think in terms of variability, that was very much about not the outcomes. We didn't have a clue whether people got better or not, because they just told us. We didn't believe the vicar necessarily. But we did want to know what were the governance systems that allowed people to come in, to be safe, to have a place where they were respected, where there was care and compassion. And one issue I think would be the whole area of confidentiality and consent. I mean, in my world, I'm called to be someone who's aware of confidentiality. I don't give information to another member of the family. If you ring up, I'm not about your sister, I'm not going to tell you, I get your permission from the sister and so on, whatever it is. Equally, that you would know exactly when I offer you a surgical procedure or an injection or a tablet, you know what it's about, you have a consent. So I thought I'd just very quickly look at a few of the features in the life of Jesus where I think it's very interesting what confidentiality and consent were. And again, different worldview, different place. John 5, the man paralysed by the pool of Bethesda says, put me in the pool. No, Jesus said, you just get up and walk. In other words, his expectation was, in a completely public place, ask for healing, go in the pool, no, you can be healed now. So neither properly consented to that healing, nor was it confidential. The 4 men who lower their friend in Mark 2 through the roof, where was the consent? Where was it? So it wasn't confidential. Maybe had he asked them to lower the 4? It was, it was implied consent. He was being, but maybe he had no choice. He was being lowered. How about the demon-possessed man in Matthew 8? There it's the pigs who request to go into the herd of pigs. So the demons asked to go into the pigs, not the man. He doesn't say, please, can you remove the pig? No, the pigs say, we want to go into the... the demons want to go into the pigs. So,
did the pigs keep consent?
I'll get there. Luke chapter 8, the woman who touches Jesus' garment. Does Jesus give consent? Someone's touched me, power has left me. Again, you could argue that was pretty, the sense of confidentiality was a big crowd. The disciples say, well, lots of people have touched you. No, so Jesus says, one person's touched me, I can feel it. So she's seeking that. So it's interesting, I'm just amused by thinking about those sorts of issues about consent and confidentiality in the ministry of Jesus. As well as, I'm sure you're right, Theo, in terms of context which we don't hear about, because in a way, as we all know, the redaction or the desire of the gospel writers was to make points about the kingdom, not necessarily about listening as a therapy. But it did make me think, because for us, I'm going to finish in a minute, I can go with it, that what came out of it for us, I think, was the sense that was variety a good thing? Is it good to have lots of options? Well, it may well be quite good to have lots of options. And one of the problems in health service is, we're trying to be pushed into a particular way of doing things, which becomes more and more about interventions which are not transformative, but they're transactional. You'll come and you'll get your thing, you'll go away, you'll get your injection, you'll get your pill, you'll get your whatever. And that's really quite, limiting. So variety can be good. And choice can be good, but not too much choice. If I give you an option of 10 chocolates, yeah, 10, I bet you'll be dissatisfied with your choice. If I give you 3 chocolates, there's good evidence for this, by the way, you'll be very happy with 1 out of 3. So remember, the more choice, but a bit of choice, a bit of variety, that's good. Virtue obviously is good, if you like virtue, whatever it is. But variability can be a problem, and I think, as we heard with the one where the dean, not the Dean of Durham, the dean stopped something because it wasn't very good. But what we found was that people didn't really say, we follow these guidelines, or we read these books, or we have this pattern. In the Church of England, there were issued in about the year 2000 draft guidelines by the House of Bishops on good practice in the healing ministry, which have obvious things like prayer and preparation, safety, accountability, the diocese, training, competency and boundaries, personal conduct, confidentiality, and public statements, what to expect. In other words, you come to this is what's going to happen, these are the boundaries. That it wasn't counselling and psychotherapy. And as we hinted at, but we didn't ask about what's called the deliverance ministry. We didn't actually want to go into deliverance, demon possession deliverance. And again, that's very clearly something that's not to be dealt with in healing ministries and partnerships. And they're in a report called The Time to Heal. And we didn't really get much back on that. People seem to be doing their own thing. Occasionally the bishop might be asked, but actually most people were a bit loose. They were free of any systems of accountability, structures, guidelines, and so on. And it did give me that slight fear of what we've had in the safeguarding discussions about safeguarding vulnerable children and vulnerable adults. And I suppose the final point being that really, if anyone does come for healing, they are probably vulnerable, in the same way that anyone coming to my practice as a doctor who is wanting help is vulnerable at that moment, and therefore I've got huge power. And I think, again, that was the whole area of power relationships and how that works. So I think, ultimately, the word we threw in the word wisdom. I suppose wisdom is knowing how to do this all better, how to balance the lament with the celebration, how to deal with consent and confidentiality, how to understand what it is in this particular context that God is calling us to do and to be, how to listen better, but also how to be confident as well that we're praying for healing in a way that is understood and consented. That healing can be these different things, but we need to be perhaps clear, what it is that's on the table. And then people will not be harangued, and their faith may make them whole, but the risk is if they're not feeling whole, then they get blamed for their lack of faith.
Thank you. Jane, Richard, thank you very much. That's been fascinating, and I'm sure that the research has opened up in many ways more questions than it's answered, but that's a sign of its success, and we hope that you'll follow this up and perhaps come back in a few years and tell us about the next round of what you've discovered in this important area. So thank you very much. Jamie, your comments on consent reminded me of an omission of mine at the beginning. You kindly consented to have the talk videotaped, so GSOM has kindly come along and taped the recording for us, and it will be eventually on the Spirituality, Theology and Health website, so that's good. And a number of people have requested this over the last year or two of these seminars. We hope that this will make them more widely available to people who can't come on the evening. As you possibly know, a lot of our students are around the north of England and aren't always able to get to Durham for the seminars, so that this is a helpful facility to have. I'm not sure, Ji-Song, whether you captured any or all of the discussion